While we move forward, there is somebody, a very senior periodontist from India, from the Government Dental College, Mumbai, Dr. Kumarswamy. He is the honorary professor, Department of Oral Implantology, GDC, Government Dental College and Hospital, Mumbai. He is the winner of the prestigious Indira Gandhi Priyadarshini Award for contribution towards the dental profession. A highly renowned person, clinical assistant professor, SUNY, Stony Brook, USA. Dr. Kumarswamy is a true COVID fighter. He was infected with COVID-19 last month and was able to conquer COVID. So, right from the person who actually has gone through it, I welcome Dr. Kumarswamy to share his views.
Thank you. Thank you so much. Good evening, everybody. Listening to over the last couple of hours to all the speakers has really enthused me. And here are my disclaimers to the viewers. I will not have any share screen. I will not have any PPT. I used a reasonable amount of PPEs for sure. I also want to tell you all that this is, like they say, tooth, the whole tooth and nothing but the tooth. The variation is my true story. Yes, I was diagnosed with COVID symptoms, I repeat. The test came later. And the point I want to emphasize here is the medical fraternity gladly appreciates and acts on the symptoms, not waiting for the results. Because results can vary. Results can actually go ahead and only help the regulatory authorities and the epidemiologists. What's important is for the patients to get treated and treated fast, which brings us to a point of acceptance. So if one thing I have learned is not to live in denial. Most of the damage happens when we live in denial. Yes, I know that there is an element of social stigma, unfortunately associated with positive patients and their families, but so be it. At least we belonging to the medical fraternity, in a way, if you will, must spread the word of caution and care amongst all that we come into contact with, to tell them that the minutest, the smallest of the symptoms has to be reported and acted upon. And we all know the importance of the pulse oximeter today. We also know that we'll take care of all the patients who come into our clinics. Despite all that, and I love the way Rita Singh, highlighted that box. It would be unfair if I were to say that I got my COVID from the patient in the clinic. Equally unfair to say that, I went to the grocery twice, probably I picked it up from there. I went to the bank once, so perhaps all of this has got no bearing, because till today, there is no way to track, trace, and prove where you have acquired it from. Till such time that it happens, let us not put the blame on others. What I would say is, probably I was destined to have it, so I had it. Having said that, did I, or was I a good patient? I think I was fairly a good patient, because we doctors are horrible patients, you know that. So I completely surrendered myself to the treatment plan, the protocols that my physician outlined. Yes, there was a flutter because of the shortage of the injection tocilizumab. You all know the suppressant. We had a problem in acquiring that. But once that was pushed in, I started showing signs of reversal. What would be my learnings from my experience of COVID? A, friends and families are precious. They are the ones who rallied around. Otherwise, you all know hospital sailings can be very boring. But they were there, hanging in, and always telling me that you will come out soon. That encouraged me for sure. The second thing that I would like to say is, you may take all the precautions. You may take all the care. if it is writ, it will happen. Does that mean that if it is writ, it will happen, so why should I take care? Let me take a cavalier approach and do all as if nothing has happened. No, that would be wrong. As much as possible, we need to take the care and precautions, because if it does happen after that, it will be to the minimal damage. Where is the role of immunity in this? We all know, as scientists, as dentists, as medical warriors, there's a huge role of immunity. Can it be bought over the counter? Unfortunately, no. Can it be built up overnight? No, for sure. What do we need to do? A, the most important thing is have a positive mind. I'm not here to serve out a Saturday evening sermon, but what I have realized is a positive mind far stronger than any medication and any immunity supplements. At the same time, control over the diet, over our intake, not only volumes and quantity, but the timing. The timing of having your vitamin B, C, D supplements, monitoring them, also ensuring that your family is doing the same line. Because only if you do it, or if only one member in your family does it, it doesn't help. It has to be a team approach even at home. So the immunity builds up over time, and that will come into reckoning if at all you get attacked by this virus. And let's recall and remember, as we have read, this virus is wild and wily. It keeps changing its, as we call in India, avatar forms. It keeps changing its forms. And it is really foxed. Scientists at national levels, international levels, even to the extent of WHO, the constant yo-yoing of WHO into the status of be it aerosol safety or airborne transmission or the use or the uselessness of the masks. I mean, you have the whole list. Let's not get into that, because that is for the politicians to tackle. We as scientists will approach it head on to say that we will do all that is possible at our end to ensure that we minimize the damaging effect and the collateral damage of this COVID affliction. Now that you are at home, or probably you have time to ruminate, to reflect, and also to think about all that you could have done, you didn't find the time, you probably have time now. Apart from reading, I would strongly encourage you to pursue a passion. A passion which need not be hovering around your dental clinics, your treatment dilemmas, or other problems in your family members. You need to develop a passion, because that would encourage you to have a wonderful feeling in the heart and stimulate your thinking, be it singing. I've been doing that. Be it an instrument. My friend Sushant, who must be watching, has now adopted the saxophone. You could adopt any of these methods to keep your mind busy and stimulated. At the end of the day, friends, your future, our future, I think, is predestined and preordained. But what we can do is make today a wonderful experience. What I call it, carpe diem. Let's enjoy this moment, the now. We've always been worried about the tomorrow, and we probably have not learned enough from the yesterday. So it is today that's an opportunity. So let's enjoy what we are doing today, be it this webinar. And yes, Dr. Ayaz, I loved your webinaritis, because it is getting to a point, and if I go on this for the next 5-7 minutes, whatever few people have logged in also would probably log out. So I would spare them that agony, I would spare us the embarrassment, and I want to thank Badal Gulati, Dr. Puneet Batra, and all my wonderful colleagues across the Southeast Asia demographics, which has come to the fore. And yes, we need to hold our hands together, because I think if at all this virus is rendered ineffective, it is towards collective prayers. And collectively, we will conquer this. This too shall pass. Thank you.
It's an amazing feeling listening to you, Dr. Kumarswamy. It was wonderful. Actually, you were telling from your heart what you've undergone, and what you have conveyed should actually be an inspiration to everyone. That whatever might happen, you have to learn to accept and learn to live with it. And also, it's like this, that it's part of your journey. So you better use your time as well as you can. Thank you so much, sir. We are really enlightened. Well, with this, I would say that we overshot time, but there was a lot of meaningful discussion which happened today evening. Thanks to all the panelists, all of you contributed. To you had a great contribution, and now let's conclude. So, what is the conclusion? What is COVIDified future of dentists? Is there no future, or what is going to happen in the next course of time? What is going to come? There is a lot of speculation what the future holds for dentistry when this pandemic is behind us. There is a lot of talk about virus mutations. There is talk about numerous other viruses coming to the fore. But look at the positive side of it, that COVID has now, even though become a part of life, but health is now becoming a center stage for public policy. Everybody, all of us have stood, rethought about our health. All of us, even though there were lockdowns, we thought about our health. So, as professionals, as healthcare professionals and dentists, we have to play our part in preparing both ourselves as well as our staff, as well as the patients who come to us for this new reality. We need to innovate and learn. Again, a very beautiful saying by Darwin, survival of the fittest. It's a time where you need to have patience, share your experiences, and come out as winners. So, this is what has happened today evening. A whole group from this Southeast Asia has collaborated together, have shared their experiences, and I'm sure that, like all of us, this future is filled with promise and hope for all the dentists. Thank you very much, all of you. Thanks.